See a lot of ultrasound scan and saying that I've done tests. Then we also, I'll just in passing mention how to cope while you're waiting to achieve your bundle of joy. You know, in trying to achieve pregnancy naturally, there's some issues that come up. How many times should we have sex? When do we have sex? How to have sex? And then the elephant in the room most of the time is life factor issues, which we are going to also mention as we go on during the course of this program. Let me start with the disclaimer that these are just guides. There are no guarantees. So we're not saying that if you do this, you're going to get pregnant, because sometimes there are real issues that need to be tackled before you can achieve pregnancy. And that's why we say we should also talk about when to seek help and what tests to do. But our aim primarily is how can we achieve pregnancy naturally. We all know that there's some things that need to happen before we can achieve pregnancy. Sperm have to meet with eggs, okay, during sexual intercourse, or if you're doing IVF or we're doing IUI, as we're going to talk about later on. And fertilization must take place. And then before the fertilized egg or the embryo implants in the uterus, and then a pregnancy ensues. When we're talking about achieving pregnancy naturally, for you to be able to be effective, you need to have at least intercourse of 2 or 3 times within a week, okay? And when you do this, the likelihood of pregnancy is about 75 to 80% in 1 year. And it increases to about 90% in 2 years. And that's why we say that if you've not had a baby, if you're trying and you've not had a baby by 1 year, you need to find out why this is not happening. Okay? And then nobody after 2 years actually should still be waiting, not doing anything. Because we know that if there's nothing wrong, about 90% of the people or couples should have achieved pregnancy. Now, to increase the likelihood of pregnancy, we know that sexual intercourse need to coincide with when an egg is present. You know, we say sperm and egg must meet. So in the body, we know that at intercourse, a man releases the sperm into the vagina. Now, if there is no egg present, then it's like no work done. So when you want to increase the likelihood of pregnancy, it's better that this intercourse takes place around the time that ovulation takes place. We know that sperm can stay in the reproductive system for about 3 to 5 days. Okay, but the eggs are not that rugged. They stay for only a very limited period of time of about 12 to 24 hours before they just die off. So ovulation monitoring definitely can help in increasing the chances of pregnancy. Now, I must say this upfront, that there is no evidence that any sexual position will affect fertility rates. Okay, so it's not your sexual position. Some people do all kinds of things because they're trying to achieve pregnancy. They put pillow at the back. There is nothing that suggests that any sexual position will affect your pregnancy rate. But there's some things that you can avoid. Certain lubricants might be spermicidal. They might be killing sperm. Things like olive oil, even the saliva, it's better that you avoid using this as lubricant. Also, there's no evidence that prolonged rest after intercourse helps. You know, so because there's some people after intercourse, some women are told to lie on the bed for 1 hour, for whatever hours. There's nothing that suggests that this helps, and it's not far-fetched. Sperm cells are living cells. So once they are discharged through intercourse into the vagina, the living cells move and they find their way to where they are needed. And therefore, that's why we say that there is no need for you to rest in the same place. And then this issue of people saying that sperm is watery, sperm is not watery, also does not make any scientific sense, because Like I said, the useful part of the semen is the sperm cells, which are living, and they just swim away. And it's also important that you do not do after intercourse. You know, like I said, lifestyle changes that you need to probably, if you want to increase the chances of pregnancy, lifestyle changes might be very, very important, including weight loss, reducing stress, reducing alcohol, smoking, and coffee. Now, so we are saying that it's important for us to be able to monitor ovulation. And this is because eggs live for a very short period of time, between 12 to 24 hours. So you are better off if you have intercourse just before the day of ovulation. So there's some assumptions when you're talking about monitoring ovulation. If your menses falls between 25 to 35 days, you probably don't need to bother yourself because you are probably ovulating, okay? Except if there are some other symptoms, okay? And we also usually assume that ovulation takes place typically 2 weeks before your next menses. So for a normal 28-day cycle, ovulation will probably happen between day 13 and day 15. Of course, there are tools that we can use to monitor ovulation. There are kits, there are apps, or you can do your calendar tracking. Just like I said, that we usually will say that if you look at your 3 months, you can see when you're likely to have your next menstrual period. And you can from there also look at, if you look at that, typically your ovulation is going to happen about 14 days or 2 weeks before your next menses. If you're able to predict when your next menses is, you can have an idea of where your fertile period is, as we want to make it sound. You can make use of free ovulation prediction app on the Nordica website. You can visit our website, www.nordicalagos.org/ovulation predictor. So the whole purpose of this is that it monitors the LH levels. And we know that ovulation occurs 12 to 36 hours after the LH surge. When the LH appears to go up, you can be expecting your ovulation to happen between 24 to 36 hours after that. And there are apps, just like I said, but all other ways of monitoring ovulation include observing cervical mucus or the temperature of the woman. Of course, we know what the limitations of these methods might be. Now, like I said, one very important factor when you're trying to achieve pregnancy is to have lifestyle improvements, okay? A healthy lifestyle is crucial. Sometimes it's only the women that look at this part of the equation. The men just think, okay, no matter what I do, my wife is the one who needs to get pregnant, but that's not true. Men equally affect fertility like women. And so age, if we talk about lifestyle, age is the first thing, okay? The age of both the man and the woman, they're very important. The woman might be more crucial in the sense that the quality of the egg tends to depreciate faster in women. But the sperm also, there are some changes in the male too. So a man who is over 45 will find it more difficult to impregnate his wife. The time interval between getting the wife pregnant might be longer than a man who is in his 30s. So, but for the women, no doubt, age 35 is a big turning point. And that's what we look at. We say if you're less than 35, you wait for 6 months. If you wait for 1 year. If you're over 35, you wait for 6 months. And also maintaining a normal body mass index is of utmost importance. So you cannot afford to eat anyhow. If you're trying to achieve pregnancy, you need to work on your weight. We know that when a woman is overweight or when she's underweight, that will affect her ovulation. But also men, overweight and obese men, tend to have lower sperm count, and what we call the DNA fragmentation index in their sperms tend to be higher. So there is nothing to be gained in being overweight or being obese. We also talk about exercise. When you're trying to get pregnant, we're not talking about extreme exercise. We're talking about moderate exercise. walking, aerobic, which also not only helps you with fertility, but also improve your lung capacity and blood circulation. Okay. Like we said, you can't just eat anyhow. So healthy, balanced diet is so important when you're trying to achieve conception. And that's one of the things you need to do this year. You must try to eat healthily. There is little evidence that a specific type of diet increases the chance of fertility. Of course, the Mediterranean diet has been touted, but there is no doubt that when you lean meat, fruits, vegetables, and whole grains, it's beneficial for everyone. And when you're trying to achieve a conception, it's important that you stay on a supplement of 400 micrograms of folic acid daily. That is the recommendation by the American Society of Reproductive Medicine. So it's important that you also take folic acid. That reduces the chance of some abnormalities in the babies when you finally get pregnant. What are the things to modify? What are the things to remove from your lifestyle? Smoking. Smokers are twice likely to have infertility than non-smokers, both men and women. The chance of ectopic pregnancy is higher in smokers. And of course, the chance of miscarriage is higher in smokers. So smoking is something you really need to get rid of if you're trying to conceive, especially in this year, especially if you want to conceive this year. Caffeine, we know that higher risk of miscarriage in people who drink more than 1 cup of coffee per day. Alcohol is another thing, it's one of the things you need to get rid of or reduce drastically. Drugs, recreational drugs like cocaine, marijuana, weed, whatever you call it, they're things that you need to get rid of. Also beware of some prescription drugs like steroids. People, anabolic steroids are a no-no for men who are trying to get their wives pregnant, and also some antibiotics, and you need to watch out for some antibiotics. People who are who have some particular type of jobs, who are exposed to some things like in the paint industry, like in fuel stations, and all these aerosols also need to watch it. And then exposing your testes to high temperatures, like using laptop, hot tubs, tight underwear should also be avoided. We need to avoid exposure to chemicals in different ways, including even some of the things that we do for recreation. Like if you play golf for a long time, you're exposed to, especially if they use pesticides on where you're playing, then you really need to be careful. Then, of course, sexually transmitted diseases are some things that we need to really try to avoid by staying true to our partners or by using a barrier contraception like condom and so on and so forth. When you're not sure, when in doubt, use condom. All right. Now, when you've done all this and it still seems not to be happening, when do we see a doctor? Because you see, it's not on when I see some people and they say they've been trying for 6 years. Because if you have been following the program, you see that if you have been trying for 6 years, what you're saying to me is, in essence, is that probably the best times are the times that you're waiting. You know, what we've said is that if you are more than 35 years, 6 months is enough for you to try, and then you seek help from a doctor. Not necessarily a fertility doctor to start with, but you need to, but if you are over 35, you're better off seeing a fertility doctor. If you are less than 35, you can try for 1 year. But when you have some symptoms like you have irregular cycles, then you cannot afford just to wait. You have severe menstrual cramps that make your chores to your life to come to a halt when you are menstruating, or you already have a diagnosis of endometriosis, then you don't need to wait for even 1 year. See your doctor once you've tried and it's not happening. When you have sexual dysfunction like erectile dysfunction, or you have severe dyspareunia, that is when you have pain, very intense pain when you have intercourse. These are pointers that something is likely to be wrong and you might need to see a doctor. So I think these are some of the things we need to take note of. And then this year, and see whether we need to see the doctor, okay? Because we're not just talking about how to achieve pregnancy naturally. We're also talking about when you need help, for you to know that looking for help when you have infertility is not abnormal, you know. Everybody goes to, you know, one of the problems we're having is to see infertility for what it is, that is a medical condition. Now, when you are seeing a doctor, at least 4 tests must be done for you to know that you have been properly investigated. Your husband's semen analysis must be tested. And like I said, this is not something that you can see with your eyes. So stop telling me that sperm is watery, sperm. No, there is nothing like that. Please go to a laboratory, let the sperm be tested. Then the blood test that we need to do to be able to see whether you are ovulating, whether your egg stock is good enough for you to be able to achieve a pregnancy. Let me tell you something. It's not everybody that needs IVF when you have proper fertility evaluation. And this gives us the opportunity to be able to sort out those who some people just only need to be advised. Some people need only medications. And then some people need, of course, to do IVF. It's also important for you to do the X-ray procedure that we call HSG, which shows the tubes and the inside of the uterus. And because we know that the commonest problem with women getting pregnant in this environment is blockage, tuber blockage. And so it's important for us to be able to look at what the tubes are like. But anytime I talk about this, I always like to point out that in 2022, there used to be something that we used to call tuber flushing. I think that only belongs to the realm of medical history. It's no longer relevant in 2022. And I keep using every opportunity to tell people why that procedure is no longer relevant. You know, when you have tuber blockage, all right, it's like you have your drain in the kitchen blocked. What happens? There's backflow of water. If you leave that water in the sink for a day or two, what will happen when you get to your kitchen? It starts smelling. The same thing happens in the body. Why? Because there is bacteria. The bacteria in all the food that you wash there are back, and they will multiply over. The same thing happens in our bodies. When there is stasis, there is infection. And so once the tube is blocked, there is stasis, and all the things that flow through the tube normally, because the lining of the tube secretes mucus, and therefore this cannot flow. So it accumulates. After some time, bacteria take over, and there is infection. Now, imagine somebody now coming to pump saline or water into that cavity and try to flush it, as it were. And then sometimes, because this blockage is so tight, the more you pump water to it, the bigger the tube becomes. But there's a limit to what the tube can become. So after a while, it happens sometimes that the tube just bursts. Now the tube bursts, the water that is in the tube is already infected. So what do you have? You have infected fluid coming into your peritoneal cavity. And so you can have what we call peritonitis. And because most of the time that is not, you don't even recognize that. You just think you're having abdominal pain, but what you're having is terrible infection going on. And so sometimes it can even lead to death. So it's important that we don't subject ourselves to this tuber flush in 2022. 20, 30 years ago, we did not have anything so concrete to do. And that's why sometimes also, one thing I also forgot to mention is that because primarily what the tubes do is that it transports the egg both before it's fertilized and when it picks it up, and when it is after it's fertilized, it transports it to the uterus. The tube is lined with some hair-like things inside it. And it's just like the hairs that you have in your nose strings. Now, when there is this ballooning of the tube The pressure destroys the fine hair-like things that are responsible for transporting the fertilized egg to the uterus. And so even if we do tubal surgery and we're able to open the tube, we cannot repair those hair-like things. And what do you have? That's why sometimes when after tubal surgery, what you have is an ectopic pregnancy, because now there is fertilization because you have there is thoroughfare in the tube. So the sperm and the egg actually meet, but it cannot be transported back into the uterus. And after a while, the fertilized egg just attaches to the tube and you have a tubal pregnancy or an ectopic pregnancy. The other test that you must do is what we call a scan. Unfortunately, most of the time, this is the only test that is done, and people say, oh yeah, I've done a scan. And the doctor said there is nothing wrong with me. If you've listened to me very well, you see that doing just a scan cannot tell you whether there is something wrong or there is nothing wrong. Now, when we do all these 4 tests, we're able to tell in about 85% of the time what is the cause of infertility in couples. In about 15% of the time, these tests do not show anything. So is this 15% of the couples that we call unexplained infertility? But unexplained infertility does not mean we cannot treat. There are treatment options even for unexplained infertility. And that's where I now go to the treatment. After the investigations have been done, I told you, for you to be properly investigated, at least 4 tests need to be done. From these 4 tests, there might be need to do other tests. But at least these are 4 standard tests that must be done. Seminal fluid analysis, your blood test to see your ovarian assay or egg stock, or to see whether you're ovulating. There must be HSG done. There must be ultrasound scan done. Now, when you have done these 4 tests and we've seen that, okay, we can now tell whether is it the man that is the problem, is it the woman that is the problem, is it the 2 of them, and then we can now profile the solution to them. Like I said, it's not everybody who comes to an IVF clinic that actually does IVF, but because there's some that will benefit from what we call intrauterine insemination, apart from the people who benefit from only drugs, very small percentage. Then also another small percentage will benefit from intrauterine insemination, which is just very low-tech form of treatment, which is washing the sperm and injecting it into the uterus. So all you need to treat is the sperm. You give the woman drugs to make sure that she's ovulating, be able to monitor when the time of ovulation. We said if you're going to optimize pregnancy, then you need to be able to tell when the woman is going to ovulate. So once we see this woman is likely to ovulate, either by doing scan or by actually triggering ovulation, then we inject the sperm into the cervix to go into the uterus. That's what we call IUI. But for you to be able to do IUI, that means your tubes must be open. The 2 tubes must be open, preferably. Sometimes some people do when 1 tube is open, but of course you know the implication of that. 1 tube, you might have an ectopic if it happens to get pregnant with the other tube that is not there. And then sometimes when the sperm must be up to par for you to get good results from intrauterine insemination. When the tubes are blocked or the sperm are not up to par, we usually don't recommend intrauterine insemination. So you might have to do what we call in vitro fertilization or IVF. Now, when you're doing IVF, what are the things involved with IVF? One, the first thing is that the doctor has seen that you qualify for IVF. And then what we try to do is to make you to produce more eggs than 1, which you normally would produce by what we call controlled ovarian hyperstimulation. We want to give you drugs to make you produce more than 1 egg. Okay. And then we do that. The doctor will determine the dosage, the protocol. And then once that is done, we monitor with the scan. When we see that the eggs have reached the size at which we consider them to be mature, then we trigger the ovulation. Now, before the ovulation takes place, the doctor must now take the eggs away from you in the theater. It's just a procedure that lasts about 15-20 minutes. Most of the time, no general anesthesia is involved. What we do is a conscious sedation. And then we take out the eggs. We don't cut you open. Through the vagina, we use the vaginal probe of the scan to see where the eggs are. And then there's a special needle that is attached to it. And we suck out the eggs through the vagina. And before the eggs are, by the time the eggs are ready, we've already prepared the sperm also, and we put them together in the incubator, and then there's fertilization. But when the sperm count is low, then we do what we call intracytoplasmic sperm injection, or ICSI, for such patients. And of course, this also, it's a variant of IVF that has given so many couples their own babies. So there are different kinds of treatment options available now, even to the fact that there is also pre-implantation genetic diagnosis where people who have genetic materials that they don't want to pass to their offspring can also do. For example, somebody who is AS and another person that is AS when they get married, we can actually do IVF for them and choose the embryos that are not SS to transfer. You know, the problem that we usually say is that when 2AS and 2AS come together, there's a 25% chance each time that they will have a baby that is SS. But with this method, we're able to knock out the chances of you transferring an SS embryo into the woman for her to have the baby that is not affected. So the baby can be AS and the baby can be AA. And yeah. And also that the same method can also be used for sex selection. For people who want a particular gender, it's also possible for us to do this, to check the gender of the baby, and then for us to use the gender that you want. So there's many treatment options that are available now when we come to IVF. And even so many things are coming up now. You know, there's gene editing is something that we are looking up to in the future, that we might even be able to, all in the sense that we want to be able to have babies who are normal in every sense, genetically. So, but while you're waiting, we are also going to mention the last 1 or 2 minutes, what are the things that we can do to cope while you're waiting. And one thing that I want to talk about is this support groups. We need to, God so good is getting more and more common in Nigeria now. We need to talk about support groups. You know, it's one of the very best things that you can do while you're still trying to get a baby. Talk to other people who are going through the same issue. That's what fellowship is all about. Fellows in a ship, you know. So if you are talking to like-minded people, you are not likely to miss it, because there's so many things still going on, even all over the world, in the world of IVF. And therefore, it's important for you to be talking to people who really know what to do, so that they can help you go through this period. I must tell you that going through infertility is one of the most challenging periods that couples can go through. And so you need all the help that you can get, professional help, support groups, but also please choose your support group carefully. It's almost as important as the clinic that you choose, you know. So your support group must be such that, because there's so many people who call themselves support group, who are just out there to part you of your hard-earned money. So it's important that you are sure of the support group that you are looking out for. And then don't forget to do other things like, there's something called mind-body therapy. You know, yoga is also can be something, acupuncture can be something that you can do. And of course, when all this, do not forget to seek professional help when you need one. I'm going to take the next few minutes to address 1 or 2 questions, and then we wrap it up. And if I don't answer your question, please be sure that it will be answered on the page. Doctor, can someone with fibroid conceive? The answer is yes, yes. People with fibroids do conceive, but it's important that when you have fibroids, please go and see a doctor who can advise you based on where is the fibroid, where exactly is the fibroid? Is it going to affect even when you get pregnant? Do you stand a chance of losing the pregnancy? These are all the things, or when you're going to deliver, can this fibroid stand in the way? Those are questions that you need to answer, and you need a doctor to be able to help you with those. Somebody says, what causes fertilization problems after the embryo transfer? Well, I get what it must be implantation you mean, because when you have an embryo, you already have fertilization. Yes, we can have implantation issues that the embryo might not attach to the woman, and then you have implantation failure after embryo transfer, and that probably is the greatest cause of failure of IVF. But when you look at it from the point of view that sometimes the problem is from the embryo, in the sense that it is not every embryo that can become babies. Don't forget, when the sperm and the egg come together, normally the body has a way of, if it's in the body has a way of recruiting only the best eggs. Okay, but we have taken, maybe we have been able to produce 15, 20 eggs. Some of them do not have the ability to become babies. And therefore, even when they are fertilized, they are not going to continue to grow because they have some inherent problems in them that does not make them to be able to become babies. Also, the fact that you can have problems with the uterus, which probably is also not allowing, like somebody just asked whether fibroid can make a woman not to conceive. And I said yes and no, because in some cases, if the fibroid is occupying where the baby should be, it might make it very difficult. So this can also make embryos not to be able to attach to the endometrium. And of course, sometimes when you transfer, three things happen, or three things are in action: the embryo, the uterus, and the fact that the two of them need to talk, the chemicals that are released. So if the chemicals that are released have issues, then also you might not be able to conceive. So we have three things: the embryo, if there's a fault with the embryo, either with the number of chromosomes, or there is a genetic problem with the embryo, you might not have a conception. If the uterus is not receptive, you might not have a pregnancy. If also the chemicals that are supposed to be released are not in the right proportion, you might also not have a pregnancy. So those are the things that can make you to have implantation failure. Sir, my question is, someone that does not menstruate for so many months without cysts, with a diagnosis of polycystic ovarian disease, what can she do to achieve pregnancy? Even when ovulation cannot be ascertained, the newly married lady of over 28 years. Yes, well, I think this, you need to see a gynecologist, because if all the problems that you are not ovulating, then it's probably, I'm sorry to say, but it might just be a good problem, in the sense that the success rate of us achieving ovulation, if that is all the problem. But the first thing is, you might need to have a proper fertility assessment, because sometimes if the sperm is even not good, so you might be looking at only one side. So if you're going to do this, it's better to have a proper fertility assessment where you look at the husband, you look at the wife, and then you can now deduce how treatment can be effective. Somebody is asking, must one do HSD before an IVF? Not necessarily, because if you are, for example, let's say you are 42 years old and you want to start IVF, or 45, I might not be asking you for HSG, because at that point in time, what comes first is your egg stock. So at that point, your tubes might not be the most important thing. But if a woman is in her 30s, then we want to know, are the tubes blocked? But of course, HSG is not the only way to look at tubal assessment, but it's probably the easier of the two methods, because you can do laparoscopy as well. But yeah, so that probably answers your question. I have quite a number of questions there, but one thing I can promise you is that we're going to answer all of them, but I don't think we might be able to answer all of them right now. I see so many people are also raising their hands. It's better if you send the questions to us so that we can answer them, because if we want to allow all the people who are raising their hands to talk, we might not be able to finish this. But I have this very compelling one that I really want to read. I'm 41 years. I had a hysteroscopy last year, March, and my menses has been regular since then. Instead of 28 days, it's now between 33 to 36. I want to do IVF this year. What do I do now? Well, please go on with your IVF. It's not unusual for you at 41 to start having cycles that are not completely regular, because, you know, I keep saying that in this environment, when all over the world, actually, women below 40 can be said to have premature menopause. Any woman above 40 can have menopause, and is not premature. So the changes in your cycle, I don't think is related to hysteroscopy. It's just natural things that happen to you. But of course, you can have IVF whether menses are regular or they're irregular. Your doctor will see to that. Is there a specific kind needed? What can you do to? There are quite a number of questions. Oh, okay, good day, sir. Thanks for the line. My question is IVF the only option for tubal blocking? No, it's not the only option. It's the best option. That's what we're saying. You can try tubal surgery if you like, but of course the success rate is much, much lower than IVF. So, and that's why we're saying that IVF is the best way to treat tubal infertility. I do have a lot of questions here. I'm trying to see the ones that are just very simple answers. I'm 50, what's my chance of having baby through IVF? Your chances can be as high as 40%, but you might need to use donor X. You will have to use donor X if you are 50. Yes, I think at this rate, with the other question, yes, I can see so many hands raised, but you know, thank you so much for this interest. I really appreciate it, but we'll answer all the questions. So kindly send your questions to info, just like at nordicalagos.org, and you'll be sure that they will be answered. It's a very good start to 2022. Thank you so much for being part of this program. I really appreciate you all, and I wish you the very best as you go on in trying to conceive and achieve your own pregnancy and babies in this year, 2022. Thank you.